We are now going to call Senator Perry Clark and Senator Morgan McGarvey to the table together. These two senators and friends of ours have been involved in this issue for some time, each of them having their own approach to the issue. But I don't think we could have a hearing today without hearing from these two senators and what their vision is for maybe the next session, what they think is politically feasible from their point of view. So, gentlemen, welcome to the committee. It's great to have you here today. And let's try to keep it to about 5 minutes, but if you could, just to share.
I'll let you go first.
Share with us what your vision is for this. Again, welcome, gentlemen.
Thank you. Thank you, Mr. Chairman. Thank you, committee. Thank you for having us today. As most of you know, I have a penchant to talk really fast, and I've got all these notes that say slow down, breathe, but I'll talk fast today because we have a very short time to say some very important things. This is an issue that is not going away. The hearts and the mindsets of the people are rapidly changing, as evidenced by this committee hearing, as evidenced by the people that are here. The Senate Bill 263 that I've followed in the past is an excellent piece of legislation. The doctor talked about a scheme where we make sure we have quality cannabis as medicine, where we have a good distribution system. That is a good framework, and we need to look at that bill, Senate Bill 263, and I believe the staff of Judiciary has a good breakdown bullet point on how that would actually occur under the framework of that bill. Cannabis is medicine. There's a brand new study, and I believe you have a handout somewhere along there that with me, and I want you to follow with me, and I will do it as fast as I can do this. If you will look, this is the Salk Institute. You have a package of some kind. Do they have your package with a study from the
Senator, we do have that in the packet. We have lots of things in the packet. What I would try to encourage you to do, I think it will be better for everybody, what we can all absorb today, is just summarize what is in the packets and what you think we should focus on.
Which is what I've done in my speech, but I did make them available. Very good. Here's the Salk Institute. Have found preliminary evidence that tetrahydrocannabinol, THC. Now, we've been frightened about the THC and everything, but here's the Salk Institute saying the THC and the other compounds found in marijuana, and we know there's 100, can promote the cellular removal of the amyloid beta, a toxin protein associated with Alzheimer's disease. We have an Alzheimer's problem in this nation. Whatever that number is now, 50 million people living with Alzheimer's in the United States. That is going to, in the next 50 years, increase by more than 3 times. This is an incredible study by the Salk Institute that says that. Beyond that, you look at that, journalists are trained to dislike hypocrisy. And the hypocrisy is, as the doctor says, cannabis is now Schedule 1. It needs to be moved to a Schedule 2. Here's the U.S. Patent and Trademark Organization. Here's the United States government. On one hand, they are saying to us that cannabis, there's no medical, it's a Schedule 1 drug, and according to the government, it has no medical use. It has a high potential for abuse. Do you think our government really believes that? In 1999, there was a medical patent for the use of cannabis. And if you will read this, and you've got that, and go to the website, to the government's website, the cannabinoids are found to have a particular application as a neuroprotectants. For example, in limiting neurological damage following ischemic insults such as a stroke or trauma, or the treatment of neurodegenerative diseases such as Alzheimer's disease, Parkinson's disease, HIV, and dementia. This is the federal government. This is their website. That's not Perry Clark, and that's not some wild marijuana advocate saying that. Cannabis is medicine. We talk about FDA, and I'm going off schedule here for just one moment here. We talk about FDA. We talk about the approval of FDA. The Center for Disease Control has a current study where on 17 typical drugs that we have over the counter, and I guess still some through prescription, cause 11,000 deaths a year. We know that non-steroid anti-inflammation drugs like Tylenol and things of that nature, responsible for 50% of all the liver problems. And you talk about liver, what's it called, liver
Information.
liver inflammation. Tylenol acetaminophen produces 50% of all that in the United States right now. So the U.S. government holds the patent on marijuana on one hand. On the other hand, we say it has no medical application. This is hypocrisy like I've never seen. A majority of those citing opposition to the legislation of cannabis in general say their biggest concern is increased cannabis use among teens. There are mountains of evidence that prove this is not going on. 25 states have this now. Live Science has a great report that's probably in your folder there. The National Bureau of Economic Research, who is a think tank that's been around since 1920, got 25 Nobel Prizes for economic thinking in the last 100 years, says that there's absolutely zero credibility to that entire argument. And you can look them right up, called the National Bureau of Economic Research. The argument that we say, and in all due respect, is if we say we're not doctors, we cannot make this decision. Well, that's true. We are not doctors. And doctors did not make the decision to make cannabis illegal. Doctors were at the table pleading for the government not to make cannabis illegal. And I have all the testimony that went on in that. But the politicians voted it illegal. Doctors were asking for it not to happen, and it can only be overturned again by politicians and not doctors. They can't practice that without politicians overturning that. Doctors and people are ready for it. You'll see some studies in there from Inc., the magazine, of course, and they say that 89% of the oncologist doctors are on board. I think better than 80% of the doctors are, and the doctors, and we've seen the Nurse Association came on this week, and their strong statement about cannabis being medicine and cannabis is last point. I would caution that as we go forward, 25 states have passed some kind of medical cannabis.
Senator, if you could wrap it up.
It's really fast now. Thank you, John. 25 states, 15 states are working on that right now. Nothing where they passed medical laws, cannabis laws, none of the cataclysmic ruins predicted have materialized in any state in any form. If we can move something forward like 262, we can actually set a framework again for the doctors to practice medicine and the patients not to be criminalized for their taking marijuana for their many modalities. Thank you very much.
You're welcome. And I want to, as chairman of the committee, thank you for your passion on this issue. You articulate it, and you've been articulating it for a long time, ever since I've been around. And, one of the things, a lot of what you say I can't really relate to, but one of the things you say I can relate to is that you'll be watching at home, watching television for some drug they're advertising on TV, and they'll get done with their spiel, and then through all the pretty music and the flowers and that, they're going through a litany of side effects, and they're rattling off so fast you can't hardly even understand what they're saying.
Mr. Chairman, the reason they give this litany of side effects, because a lot of these drugs that are FDA approved are doing much damage to people. The reason they do that, because there's a legal thought that if they tell you that, then they can't be held accountable for that in the end. They can't be held accountable if that happens to you.
Thank you.
Terrible.
Now, Senator McGarvey, welcome. Also, my colleague, it's great to have you here. You've come at this issue from a little bit different angle more recently, and I wanted to have you here to share your vision on maybe some legislation that you think may be viable during the upcoming session.
Thank you, Mr. Chairman. Thank you, members of the committee. I think this is a really important issue and one we are going to have to deal with as a Commonwealth. I also thank my colleague, Senator Clark, for his passion on this issue, and I'm not disagreeing with his bill, but I do have a little different approach. I've come at this from hearing all of the different arguments from the doctors, from the nurses, from the hospice associations, and saying, where is this an issue where we can find common ground? As you all know, we walk around the halls of Frankfurt and people say, what does this do? It's not just the hardcore yes or no you sometimes see in public, but I think there is an interest in this issue. Where can we find common ground to move forward on medical cannabis in Kentucky? I proposed a bill last year, Senate Bill 304, that I'm working with colleagues from both parties from across the state. I'm also working with the doctors, the nurses, the hospice association, those parties involved. We haven't quite reached a full-fledged compromise yet, but this was an initial step. We're still meeting. And what my bill did is it says, we describe medically necessary marijuana, which means It's administered pursuant to the written order of a medical professional to treat or alleviate symptoms associated with life-threatening illnesses. What this means is you're looking at it from an end-of-life care standpoint for people who are sick with cancer and for which there is no cure, for people who have diseases that they're not going to make it through. And you know what? When you look at this, why wouldn't we allow medical cannabis to these people? If you've got 8 months to live and something makes you comfortable and provides comfort to you and your family, it's done through a doctor, it's done in a responsible way, it's done in a way that we as a legislature say we're going to grow it and we're going to implement it and we're going to regulate this. Why wouldn't we allow that? We prescribe morphine and fentanyl to these same patients, literally drugs that are killing people in Kentucky. We provide that for relief to patients who have these illnesses. Why wouldn't we open up the door and allow medical cannabis for certain end-of-life situations? And we put in there end-of-life and palliative care, and that's because, like I said, we're still working through some of the specific language of this bill. I've worked with some of the people in hospice. This is not a hospice bill. I want to point that out. This is not a hospice bill. However, hospice deals with about 40% of terminally ill patients in many areas of Kentucky. That's defined as 6 months or less to live. We need to draft this artfully and thoughtfully in a way so if you've got 6 months left to live according to a doctor and you live for 7 months, we don't write it in a statute that at the end of 6 months you lose your prescription and for the last month of your life you don't have it. So we need to have that word palliative care in there to allow some wiggle room for us to deal with truly life-ending, incurable diseases. That's what this bill does. And I think it recognizes that there are some therapeutic benefits to medical cannabis and that, that people need that. Mr. Chairman, I know that your father, when he passed away, had a bottle of bourbon in his bedside table. And I think that when we have people who are at the end of their life, we need to be compassionate. We need to provide comfort. And I think you're hearing from the doctors and all the people here today that in this specific approach, there's not a lot of opposition because it does provide comfort and relief to those who need it most.
Thank you for your testimony, Senator. I have a couple questions. I don't know which senator they're for, but we'll start with Representative Larry Clark.
Thank you, Mr. Chairman. I think it's very interesting testimony of the day. And my biggest concern is, like you say, there's a strong populist movement, and I think Dr. Barnes did an excellent job, and I want to thank you for your presentation. Great to have you on U of L's faculty, too. I would encourage Senator McGarvey, Senator Perry Clark to talk to the medical profession about some kind of procedure, medical, so we know how we dispense is just not as need, but we got to have the medical society engaged to make sure that when we do pass something that it's not for recreation, but it's actually for medical marijuana, and that's more of a statement than it is a question. But I do think that, Senator McGarvey, you talked about you're already working with them, and I think, Perry, you need to do the same thing. So when we do come back, I won't be here, but when we come back in 2017, I think we have a better comfort zone that the medical society is engaged in this process. But I want to thank both y'all for your excellent testimony. Thank you, Mr. Chairman.
Thank you, Larry.
You're welcome. Senator Symes.
Thank you. Senator McGarvey, I do not disagree with your bill whatsoever, but we went through the legislation. And by the way, I do have a granddaughter who's epileptic. So I really followed the oil issue that we talked about going back in the last couple of sessions that we passed that legislation. And obviously the oil is not available because of the federal government. So I don't know that we can just sit here and talk this to death until we have some relief at the federal level. I'm not sure what's the point. For those that don't know, federal law supersedes state law, and we're kind of stuck with that. And is the battle not with the U.S. Congress rather than here?
Thank you, Senator Simon. I appreciate the question. And I say those are thorny issues. This is an example. I've heard President Stivers talk about often when you go to the supermarket when you're in the legislature, the bread aisle is when you're talking about the budget. You move over to the dairy aisle, and that's when you get asked about whatever piece of legislation. In the summertime area right now, I feel like the pool serves as that kind of that area as well. And a lot of people are asking about medical cannabis. And one of the things I say is this is not just a simple issue of yes or no. There are a lot of things we have to go through. What I will say is that there are 23, 25 other states that have done this. And one of the issues, for instance, I'm working on with my bill, we've already convened a group this summer of people in the medical profession and legislators to get together and look at how have the other states done it. For instance, if you have a hospice patient and that patient is getting Medicaid or Medicare dollars, how do you make sure that those funds aren't dropped if you have medical marijuana? We've reached out to other states. We've already reached out to, I think, Louisiana, Colorado, Oregon, to see how they've done this and how they've been able to do this without the action of the federal government. There are states that have been able to do it. I just think we need to work to see how they've done it. The nice thing is so many people have done this. I think we can sort of adopt a best practices act, and whatever we do accomplish on this issue could actually end up being a model for the rest of the country.
You know, I might follow up with, as a former cancer patient dealing with nausea. If I thought that, I'm going to quote a legislator out of the House who happens to be in leadership, but if I'd have thought that smoking a joint would have helped me with the nausea, I certainly would have fired one up. So I thought I might, thank you.
Representative Owens?
Yes, I'm just trying to get clear on cannabis and medical cannabis. And then the doctor talked about the quality of the cannabis. So how do you deal with all, I mean, what's the difference between medical cannabis and cannabis? 'Cause y'all use the term medical cannabis. So I assume there's a difference between that and cannabis.
There's really not. There's not a difference between that at all. However, under medical cannabis, under the other states, and you'll find that's under Senate Bill 263, there's a framework for the production, the distribution, the watching of the quality. It's all inside there as a management skill. And the 263s, like you're saying, it's a framework built out of the 25 different states and what has worked in those states well and what has not. But it's a whole production distribution system built within that 263. And when you talk about medical cannabis in the other states, it is tracked from its seed to its selling. They track it along the whole point, and there's a really stringent quality requirements on what that is, because different strains and different amounts of THC and the cannabidiol and the cannabinoids, there's 420 different items in there, but there's stringent quality requirements on that. Other than just throwing a plant and a seed in the ground at home and getting rolling papers.
Right. Well, and to Senator Clark's point, it is regulated. And actually, one of the things we did in Senate Bill 304, we defined what medically necessary marijuana meant. But then we had a task force that was part of that bill that was going to be implemented to say, how do we actually get this? How do we implement it? How do we regulate it? How do we grow it? How is it available? And I find that task forces don't always work. But if you do get a task force together where they're not arguing over whether or not there should be medically necessary marijuana, just in terms of the legislature has said, yes, we're going to do it, this task force is going to instruct us how to do it. And it had representatives from the Department of Agriculture, it had representatives from law enforcement, it had representatives from all kinds of different groups, including the legislature, to really tackle that issue.
We got two more questions. Representative St. Ange?
Thank you, Mr. Chairman. Just an observation on this presentation and the good doctor's presentation before. I actually, and in follow-up on Representative Owens' question, I'm actually seeing three different categories. You have the smoking the joint category. You have the non or very limited THC category, so the information that the doctor was presenting before in the CBDs. And then you'd have this category, which has a higher level of THC than is in the CBD category. And so lumping these all together, and we have already started to separate recreational use of marijuana from this medical use of marijuana, but you've got within the medical use of marijuana these two separate categories. So I guess the question I had, which was addressed on the requirements as far as medical marijuana from your presentations, the stringency of the production and all of that, that has been a concern for not just the legislature here, but that has been some of the concerns from some of the other states. is that they're not able to regulate it, whereas with the CBD, it seems a little bit more regulated in terms of its production and than the desired result. So it's really more of a comment that maybe that's a clarification that can be brought up in the future to help us sort through all of this. Thank you very much, Mr. Chairman.
You're welcome. Senator Bone will ask the last question of these two distinguished senators.
Thank you, Mr. Chairman.
You got to go.
Senator Clark, let me ask you this, because you have been a champion of this cause. There's no question about it, and ever since I've known you, you've been working on this issue. So I would ask you this: if there were legislation that were passed and it provided for highly regulated implementation of this and had to be prescribed by a doctor, it was highly restricted, and there were all of these confines, would you be happy with that? Would the people that are advocating for medical marijuana, would they be happy with stringent restrictions, or would we still have this outcry for more lenient use of marijuana?
There is still going to be the lenient outcry for the more use of marijuana. Cannabis itself has been lied about and prohibited. Even the prohibition was a lie. It's a benign plant. It's a beneficial plant. There will still be that. However, that being said, we know that's going to happen because we can look at the other states. And even though they pass medical marijuana, even in California right now, they're taking up the vote on adult responsible use. They're taking that up, but they have medical for years and years. It's always going to happen that way because none of the bugaboos, none of the hellscapes that we ever say come to fruition. Now, would we be happy with that? Yes. There's probably 150,000 people in this state that do not take to the other medications that are FDA approved mainline. Their bodies don't take it. Their livers don't take it. They break out in hives. There's a study in Israel right now, about 400 people they've tracked for over a year whose bodies physically would not take the mainline medications and stuff, and they've been following them, and in 1 year, they really have no other problem besides dry throat and red eyes a little
Thank
bit.
you, Senator.
But it's not going to stop. It will never stop.
Thank you, Senator, and thank you, Senator Boeing, for asking the question that was on everyone's mind. And now we are going to adjourn for 5 minutes, let everybody stretch their legs, and we will reconvene promptly in 5 minutes.
Thank you.
Thank you, Mr. Chairman.
Thank you, guys.